some students, when they're interested in going into counseling, for example, they have a couple of options, for what they want to do. There's counseling and psychology, and there's the ability to maybe work in research and to research different things, medications or therapies that help people, and they're kind of more the science aspect of it. There are some people who want to go into counseling more in the medical field, or they want to be a therapist, like traditional mental health therapist and a counselor that has clients and maybe works for an organization or as a private practice, and people who need talk therapy and need counseling will schedule appointments with them and meet with them. And then there's education, where we have school counselors and psychologists. We had a school psychologist on here 3 weeks ago now to talk about school psychology versus school counseling. And so there's a lot of counseling and psychology needs in education as well. But Dr. Nate, what would you recommend for students who are kind of contemplating maybe going into mental health counseling? What you'd recommend they pursue? And then if they maybe if school counseling or school psychology is more in their lane, what would you recommend they do? And kind of the tension between those two choices.
Oh, yeah. I don't know.
Sorry to ask you a tough question.
I don't want to get in trouble here, but no, I think that
hey, this podcast is known for being edgy, so go for it.
All right, yeah, right, yeah. Found the right place. I think that my advice to anybody, no matter what their age is, whether they're middle school, high school, or already out of college, anybody who wants to get into counseling, is to not be in a hurry, and to, especially if you're contemplating doing it as a career, but you're just entering college, or you haven't gone to college yet. I think that transitioning into the counseling field is a lot easier if you have some life experience before you do it. Now, that's not to say that a person can't come right from undergrad to graduate school. They can't make that progression and be a great counselor. But I find that with a lot of students that I deal with, it's that life experience they've had prior to deciding they want to be a counselor is the most valuable gift they have, because it gives them a perspective. So when they get this training to be a school counselor or a clinical counselor or a school psychologist, whatever it might be, they just have a broader understanding of people. I think that's really important. But I would say this, that anybody who wants to get into a field like this, if you inherently, or if you just feel like you want to help people, you'll find the right spot, right? There's more than one way to be of help to people. And maybe you start off thinking that you want to do it in one area, but after you do it for a while, you figure that you might be a better fit, or you might enjoy it in something else. I think that I would encourage you to pursue that until you find the right fit, so that you can help people in the best way.
Okay, well, I would say this anecdotally, though. So I occasionally am one of those instructors that Dr. Nate is talking about. I get the privilege of teaching some classes for him occasionally. And I don't know about you, but anecdotally, I will say, I feel like there's been several students that were in clinical mental health counseling. They were mental health therapists, and they leave that, and then they come back to do to be a school counselor. We had interns here 2 years ago, two of them that both previously had mental health degrees, master's degrees in mental health, and then went back to become school counselors. But I can't think of any, and I know a lot of colleagues I have that were mental health therapists and now they're school counselors, but I cannot think of one instance, maybe one, of someone being a school counselor and then wanting to go do mental health. I mean, I can think of like a half of an example, but I can't, but I just see a lot more the opposite way. Do you think that's accurate? And why do you think that happens? Why do people leave, traditional mental health counseling and come to work in schools, do you think? Or is my perception just way off?
No, your perception is not off. I do know of some people who've gone from school to clinical, but they also went to a program that allowed that transition to be easier. But I think that, I'll be honest with you, most of the time when people have chosen to move from the mental health to the school counseling, and they've made that transition, it's for family reasons. They have students who are in school and they want to have a schedule that matches that. And here's here's something to think about. School counselors tend to make more than clinical counselors.
Really? That's
And
surprising to me.
yeah, yeah. So
Interesting. Yeah, if you think about it too, like people that need to do therapy, they're usually busy during the day. Like even if it's students,
right.
students are in school, so we occasionally have like in-school therapists, but it's usually like a different program that we have that's like people like are getting their certification in it, so they're kind of new. But yeah, if you want to be a therapist, you're going to have to work outside of school and work hours, so like in the evenings a lot. That's a
I
good
think
point.
it's a really tough job. I think there's a definite like trade-off. I think with depending on how you do like mental health therapy, because you can work in an agency and then a lot of times you're not paid as well, but there's maybe some structure and better benefits there. On the other hand, you can work in private practice and have your own flexibility and have, a little more autonomy, or you can kind of do what you want in your practice. But then everything, you have to do the billing, you have to work with insurance, and working with healthcare is very difficult. Yeah. So working in a school district where there's a very set schedule, you have a very set caseload, you get health insurance and a contract is alluring for many.
It is very alluring. Yeah, it is. I mean, it's very appealing for a lot of people, but let's be honest, right? If you walk into a school, the coolest people in the school are school counselors. We all know this. I mean,
Depends on the school, but yes, most of the time that is true. I'll bring up one thing too. So, we had an awesome school psychologist a few weeks ago that talked about like what do school psychs do versus school counselors, and comparing the counselors and psychologists from like the Sharks and the Jets. But kids, you'll have to ask your great grandparents about that reference. Or your music theater teacher, either way. But what is required, since you're an expert in school counseling? Can you talk a little bit about, because I know requirements have changed, and you talked about the difference between going for school counseling and then making the jump to clinical mental health counseling, and how some programs that's easier, but a lot of the changes in requirements for school counselors nowadays, it's going to make that even more easier. So I guess my main question is like, what is required? What type of trainings do school counselors have? What is required to be a school counselor? What are some of the amazing things that they're exposed to in their training with you or in a similar program?
I think it's interesting because the state of Washington has made the transition so that every school counseling program is going to basically meet the same standards now. And so, and this was my experience when I went to graduate school to become a school counselor, that all the counselors, whether they're clinical, marriage and family, addictions, everybody is in the same program. So everybody's actually getting the same training. Everybody's getting the same classes in terms of theory and, practicum. The only difference is that once you get to, whether it's your second or third year in the program, you do your internship in the field where you actually plan to work. So the school counseling students intern at school. The clinical mental health, they intern at an agency or with a licensed clinical mental health counselor. So the training is actually for everyone the same. And it's, even though school counselors aren't going to be going into clinical mental health, they're going to get the same mental health training that those counselors do. So that just happened over the last few years, but I'm excited about that because I think that actually is better for counselors in any field to get, the same level of training.
That's great. Yeah, because there is a misnomer out there, because historically, when you look at like the history of school counseling, we've been seen more as guidance counselors and helping students kind of plug in, like you talked about at the beginning, to what they're supposed to do, the school to college jump, or into their career field, and specifically honing in on that. But now they've expanded to be so much more, to be mental health professionals that are working in schools. And that's been a tough misnomer or misunderstanding to kind of like correct in education, I think, because so many people still have that misunderstanding today.
Yeah, I mean, that, as I would say this is how I look at the difference between a school counselor and a clinical counselor. Let's just say. The school counselor knows just as much as the clinical counselor, just like a nurse knows just as much as a doctor, right? A nurse has to know just as much as a doctor to do their job, because the nurse is around the patient more than the doctor usually is. So the difference is more in a level of responsibility, or you know what I mean? But the training is the same. And school counselors have to understand things just as much as clinical counselors do. And a lot of times, school counselors are responsible for explaining to families and students what they may have been told if they're working with a clinical counselor. You know what I mean? So
Totally.
yeah.
Yeah. And, you know, and we'll, of course, we'll see hundreds of kids a day in regular school when we're in person. But I mean, you're talking, we'll close the door and let's have a real, you know, counseling conversation with the student. I'll see 12 to 15 kids a day easily,
Right.
you know, I mean, at least 10 coming down or for whatever reason. And you don't get that type of volume as a clinical mental health counselor. But
No.